Part 1. Update UTI infection. Virtual phone call update UTI infection, between doctor and patient me. Friday, November 3, 2023. Dr. H. Hello, Ms. D. I like to follow up with you. Miss D. Hello. Dr. H. How have things been going last little bit? Miss D. Everything has been going good. Why I was calling you because the antibiotic you have me on the UTI syringe. Dr. H. The syringe for the bladder. Miss D. Yes. Dr. H. The Gentamicin. Miss D. Yes. I would like for you to discontinue that medication for me. Dr. H. Will do. Miss D. I'm doing beautiful because you know what's happening. I'm drinking more water and flushing it out. I've been off of it for about a year. Dr. H. Yep. Miss D. When I went to go see my primary doctor in April 2023, I had her to do a urine test on me and it came back clean. Dr. H. Good. The idea is quality life. Less is more. Are you still using the powder antibiotic? Miss D. Yes, I am. I still do that on Sundays. Dr. H. Okay, perfect. So what we'll do is continue the fosfomycin. I'll send an order to the home health folks to discontinue that gentamicin. Sometime it takes a little while to go through. If they contact you, just tell them you refuse. It let them know we talked about it and is being documented today. Miss D. Okay. I need for you to take one more medication off my list. Overactive bladder medication. Discontinue that. Dr. H. Yes, I can stop that as well. Miss D. I just want to let you know what I'm doing. So what I'm doing now is I'm using my catheter bags that hangs on the bed and get rid of all my urine. When I kept catheterizing myself, I was not emptying my bladder out completely, and the way I'm doing it is I'll put the catheter in at night and at 6 a.m. in the morning I'll take it out for about 4 or 5 hours and I'll put it back in about 12 p.m. or 1 p.m. in the afternoon, and when it's time for me to get up to cook something to eat for supper, I'll take it out again about 3 p.m. and I'll put it back in after 3 or 4 hours at bedtime until the next day. Dr. H. Yep, that's exactly right. Pushing fluids, flushing the system is the right thing to do. Yeah, you're doing the right stuff. Miss D. Yes, I'm so happy. Dr. H. Good, best is more. Oxybutynin stuff is there for the overactivity, urgency and leaking, otherwise don't take the stuff. Fosfomycin is safe to take forever. Safe for your kidneys, prevent infection moving forward. I'll call in a new year supply of that stuff. Miss D. Okay, thank you so much, so glad to talk to you. Dr. H. But, now remember, and I have a standing order for you for the urinalysis if you get a bladder infection. Miss D. Okay. Dr. H. If you get an infection next week, next year, you start feeling UTI symptoms, you have that order in place, you can go to any emergency hospitals and we'll get that cooking. Okay. Miss D. Okay, I'll let you know if I get another bladder infection. Okay, thank you so much. Dr. H. If you get another one, just give me a call and I'll send you some medicine to the pharmacy. Miss D. Okay, thank you so much. Nice talking to you. Dr. H. You too. You have a great weekend. Miss D. You too. Bye. Dr. H. Bye. These are my thoughts when I talk to my doctor. I thought he was going to tell me no, don't use that catheter bag because you're asking for an UTI infection, but everything I'm doing to prevent my bladder infection he approved. That just made my day. I'm doing this because soon I'll be 65 years old. That means I'll be paying for most of my medication out of pocket, and that's why I'm trying my very best to get off all the drugs that I do not need. 5 thumbs up for my doctors. University Hospital, Bedford Medical Center, Cleveland, Ohio. Doctors are the best in my case. Who is your favorite hospital? Leave comment below. Continue following me. Part 2. Document was put in my chart about my UTI condition. Have a blessed day. Bye, Leona.